This is chapter 3. This is what happens inside the body. Multiple chemical sensitivity involves abnormal physiological responses to low-level chemical exposure. The body becomes sensitized. Substances normally tolerated trigger disproportionate reactions. Exposure occurs through inhalation, skin contact. Chemicals interact with sensory pathways and cellular receptors. The body interprets this as a threat signal. The nervous system activates rapidly. Key pathways include trigeminal nerve, autonomic nervous system.
Including vagal pathways.
The trigeminal nerve detects chemical irritation in the face and airway. The autonomic system responds with regulatory disruption.
This activation can trigger neuroinflammatory responses, heightened sensory signaling. Pain pathways become amplified. Signals that would normally be minor are interpreted as severe.
The airway responds. Constriction, irritation, reduced airflow. Breathing becomes restricted.
The reaction is not localized. Multiple systems activate. Nervous system, immune signaling, inflammatory pathways. This creates a full body response.
Once triggered, the response escalates. One system activates, another, symptoms amplify. The body does not shut it down immediately.
Pain can be severe due to nerve involvement and amplified signaling. Facial pain, head pressure, systemic discomfort.
Some patients report pain levels comparable to extreme physical conditions, including childbirth.
The reaction persists after exposure, hours, days, weeks, sometimes months from a single event.
Repeated exposure lowers tolerance. Smaller exposures trigger reactions. Sensitivity increases over time. The threshold drops.
Because of this mechanism,
the body cannot safely process exposure. There is no reliable way to stop the reaction once triggered. Avoidance is not optional. It is required to prevent activation of these pathways.
this is not psychological. This is a physiological response involving nervous system activation, inflammatory signaling, systemic reaction.
This is what happens inside the body. This is why avoidance is the treatment.
This is what happens inside the body.
This is why avoidance is the treatment.